Impulse control disorders. Impulse control disorders are a group of mental disorders characterized by the failure to resist an impulsive act or behavior that may be harmful to self or others. People with impulse control disorders often experience tension or anxiety before committing their damaging behaviors. The behavior brings the patient some sort of satisfaction even though it may be socially unacceptable and out of character behavior for that person. During the act, the person probably will feel pleasure, gratification, or relief. Afterward, the person may blame himself or feel regret or guilt. Impulse control disorders and substance abuse are similar in nature, as the compulsive actions and inability to control them are very similar to symptoms of drug or alcohol addiction. Substance abuse may even be a contributing factor to the onset of an impulse control disorder. Impulse control disorders are closely tied to conduct and disruptive disorders. The onset of these disorders usually occurs between the ages of 7 and 15. Impulsivity is the key feature of these disorders. Five behavioral stages characterized impulsivity: an impulse or urge, growing tension, relief or pleasurable feeling on acting, relief from the urge, and finally guilt, which may or may not arise, and repeated participation in such behavior even in the face of negative consequences. Types of impulse control disorders: intermittent explosive disorder, characterized by uncontrolled fits of extreme anger and violence. Pathological gambling, repeated betting behavior or compulsive uncontrollable gambling. Kleptomania, irresistible or impulsive urge to steal from stores or home, or unnecessary stealing of things that are not needed for personal use. Kleptomania is more common in girls. Pyromania, deliberate and purposeful fire setting on more than one occasion. It has been observed that the incidence of fire setting is more common in juvenile and teenage boys than girls of the same age. Trichotillomania, uncontrollable hair pulling often resulting in bald spots, more common in boys. In addition, compulsive sexuality, compulsive buying, and more recently other problems such as internet addiction and computer game addiction be considered impulse control disorders because they share similar traits. In general, all of these problems are characterized by an inability to control one's actions. Even if these individuals have the desire to control their behaviors, it can be impossible as they continuously experience an increasing urge or craving to engage in the behavior, which may interfere with a person's ability to function in daily life. There are a number of disorders that can occur alongside impulse control disorders. Some of the most common mental disorders that can occur with impulse control disorders are mood disorder, depressive and anxiety disorders, obsessive compulsive disorder, post-traumatic stress disorder, conduct disorder, oppositional defiant disorder, attention deficit hyperactivity disorder, and antisocial personality disorder. Causes. The exact causes of impulse control disorders are unknown. A combination of biological, environmental, psychological, cultural, or societal factors may play a role. Chronic stress, coexisting mental health problems such as depression or obsessive compulsive disorder, childhood trauma, or neglect may also contribute to the development of an impulse control disorder. Children and adolescents who have had a severe head injury and who have epilepsy may be at greater risk of developing these disorders. Symptoms: aggression, agitation, irritability, socially inappropriate behavior, destruction of property, angry outbursts or temper tantrums, compulsive stealing, compulsive lying, playing with fire, participating in risky sexual behaviors, brief periods of emotional detachment, lack of patience, difficulty concentrating, obsessive thoughts, social isolation or withdrawal, anxiety and depression. Treatment: medication, Medications may be helpful in treating impulse control disorders, although there are no drugs specifically approved for the treatment of these disorders. Medications that may be used include antidepressants, mood stabilizers, and antipsychotics. Behavior modification, long-term counseling, and psychotherapy is usually necessary. Cognitive behavior therapy. CBT helps people change their thoughts and behaviors in order to improve their lives, helps identify the exact nature and consequences of the problem and identify and correct distressing thoughts or prevent the damaging behaviors from happening, helps practice relaxation skills and stress reduction skills which can help relieve these feelings and provide a healthier intervention, helps patients appropriate behaviors and learn to gain control over their impulsivity. Individual therapy. Individual sessions are held at least once a week and on a one-to-one basis. The patient is encouraged to discover for himself the reasons for his behavior. The therapist listens to the patients and identifies negative thoughts, teaches appropriate behaviors, and helps them learn to gain control over their impulsivity. Group therapy helps discuss family issues, anger management, and sexual safety. Family sessions are held once a week to help family members learn how to overcome negative behavior and the uses of various strategies to reduce problematic behaviors and ways to enhance coping and social skills. Effects of impulse control disorders. The effects of impulse control disorders can be extremely miserable to the lives of children and adolescents who do not receive treatment. Some examples of the types of effects that can result from impulse control disorders can include low self-esteem, difficulty in maintaining interpersonal relationships, failure to achieve academic and career goals, self-injury or self-harm, involvement in criminal activities, suicidal thoughts, and suicide. Thank you.